1 second. I'll just say 1, 2, 3. We can get started. You can get started. We are live.
Dear viewers, I welcome you to the third episode of Run Pe Charcha, Injury Prevention and Injury Recovery. If you have missed our episode 1, She Runs, She Conquers, where our guests were Dr. Madhuri and Commander Priya, or episode 2, Train and Trail, where our guests were Mrs. Anita and Nitin, you can visit VTRA's YouTube channel. So, viewers, consistency is the key to success, and staying injury free isn't an option, but it is essential for a runner. So today we have with us Commander Amit and Dr. Krishna Chaitanya. Commander Amit. Commander Amit is a respected name in the field of long distance running. From being the only finisher at 222 kilometers La Ultra in 2019 to successive podiums at Malnad Ultra, Deccan Ultra, and many more. His trophy case is overflowing. He's approaching his 48th birthday, but is regularly seen flying past youngsters on roads and trails. He's consistent and versatile endurance athlete. Not only this, he's a qualified advanced mountaineer and a qualified paratrooper. He has won best student trophies in basic skiing course and sea diving course. And he's the founding member of VTRA. I welcome you, Commander Amit. Dr. Krishna Chaitanya. Dr. Krishna, doctor by profession, and he's a triathlete. Dr. Krishna began his journey as a competitive swimmer, and he started representing his state and university at national levels. In between, he took a break and pursued his higher education at US. And after running back from US, he started representing his state in nationals in triathlons. He enjoys trail running too. Not only this, he has completed Ironman 180.6 at Barcelona and Hamburg. Presently, he is also serving as the secretary of VTRA. And he has motivated me to participate in the river crossing competitions also. So I welcome you, Dr. Krishna Chaitanya. So, Dr. Krishna?
Yes.
Yeah, your video, right. Can you switch on your video, please?
I did actually. I think you have to ask me to do that. But last time.
Okay, no problem. We'll start. We'll go on. By the time you can switch it on. So, we are audible. So,
yeah, you are audible.
Yeah. As a triathlete, I'm sure swimming and cycling ensure that you cross train. So, how does cross training help you stay injury free?
So, it is not by choice that I have to do cross training. It is because it's a part of my game that I have to do all the 3 sports, and I can't let one go away not training for a while. So I keep on rotating myself from swimming to running to cycling, and keep on doing all these things simultaneously in every week. So so it is not by choice per se. But I think that the advantage of cross training, like many runners, they don't do it actually. They don't incorporate in their training plan. Maybe because of time constraints, or sometimes they feel that they might lose the edge in running. But that's something that need to be ingrained into their training, that they have to do cross training, and not necessarily cycling. Whatever they feel like, some people can even do it on elliptical, because that also mimics running in some ways and taking off the impact. So cross training is essential, is as essential as weight training, because cross training, it takes the load off your muscles and yet gives the benefits of cardiovascular exercise. So I think cross training also helps you prevent the injuries because you're taking off the load on the muscles that you run, and thereby helping them to recover. So a recovered muscle is much more stronger than one that is already tired and fatigued for the whole week.
Okay, so cross training is really helping you as a triathlete.
It is
Okay.
not cross training. Actually, I would like to put it the way it is. It is my sport. I have to do it regardless. So, so it is like it is both. It is cross training
That
and
is,
also
yeah.
training for my triathlon as well.
Oh,
So
okay, understood.
yeah, yeah.
Okay. So, Commander Amit, so I've been watching you running for more than 20 years now, and you have running largely injury free. So, are you blessed or is there a secret ingredient?
As I said, there is no secret ingredient. Yeah, having been married to me, you don't have an option but to see me, getting up at crazy hours and going for runs. So, yeah, I'll take that as a compliment that I have been running injury free, and I'll take it as a blessing also. But yeah, there's a lot of method to this madness. There are a lot of things that you have to do to ensure that you stay injury free. Uh, 80-20 is the golden rule. Most of the runs easy. You know that I hit the gym very regularly. Yoga is essential part of my routine, and stretching. Uh, so all this is a combination. It's a package. So if you plan properly your fitness routine, you will mostly stay injury free. But the most important part, the secret ingredient, as you call, is that you don't get carried away by the hula hoop, by the noise around you. Uh, if somebody like uh, labels you as a fast runner, or somebody labels you as a super duper runner, don't get don't get carried away by that. You should always know what your limitations are, what your capabilities are, and train according to that. If you do that, I think largely you should be able to stay injury free and should be able to consistently be at it and improve. That's the
Okay.
short.
Okay. So, Commander Amit, you have partnered with the best in the game and have motivated many, including me. So, although avoidable injuries do crop up once in a while, so how you classify them?
I'm glad you asked this question because classifying injuries is a key element in avoiding injuries. If you're able to understand what this injury is, what is the reason behind the injury, you will be largely able to prevent it. So yes, what you said earlier, I've been lucky to have having partnered with people who have represented country for ultra distances. Abhinav and Suman are names which are well known in the country, and I've learned a lot from them. Uh, so what do I do is the way I look at it, running injuries are broadly classified as muscular and skeletal injuries is one section of it. The other section is which is temperature and weather related injuries. And further, when you subdivide the muscular and skeletal injuries, now you can look at the way they are induced. So they can be induced by overuse, by wrong gear, by wrong form, and by fatigue. And your temperature or weather related injuries can be induced by exposure to extreme heat or extreme cold. Running like La Ultra, you have to be very, very careful about the frostbite and about hypothermia. When you're running in weather like Vizag, you have to be very, very careful about being dehydration, or about a heat stroke. So this is how you should go around, see where you are running, how you are running, and classify the reasons which can induce an injury, and be careful about avoiding all those things.
Okay. So, Dr. Krishna, will you please elaborate on this little bit, this musculoskeletal injuries, and how can we prevent them?
So as Amit has said that being carried away is the most common reason to have a musculoskeletal injury. So most of them is overuse. So overuse is either you are increasing the mileage unreasonably from what you're doing in the past, and also the intensity, like you're running more faster than usual. So these two come sometimes both of them together. These overuse injuries crop up, and there are something that it is completely avoidable. Actually, to be very frank, if you are like maintaining a training journal, I don't know how many people do that as of now. With Strava, we can definitely keep a track on how far you're running, how fast you're running. And also the AI has cropped up in Strava that is telling you like what you are doing, are you overtrained or fatigued or whatever. But regardless, if you have a plan and you maintain a strict routine in your training, you can avoid this overtraining. So overtraining is more worse than actually no training. So, so overtraining keeps you off of your training for a long while once you have an injury, and then you are out of training for a long while. And at the same time, it deteriorates your performance as well. So overtraining is one issue. The second one, as he elaborated, is that a wrong form. So there is actually, to be very frank, form is different from differs from person to person based on his anatomy and his strength, and then his experience in training for these events. So form can be modifiable. If you're like really going very bad on form, you can really fix those forms through drills and all that. But very few people actually do drills. Like, most of them are self-trained people, so usually don't have an idea like what is a running drill. Most of them, like I have seen many people who don't have any concept of drills, so they have to be trained as well in that aspect. So and then regarding the musculoskeletal injuries, like as a runner, you usually have two things. Usually it is either a knee problem, which is like a runner's knee, which is very common. And other few things are like IT band, which is another type of a knee issue as well. And then when you go down on the lower legs, you have shin splints, you have plantar fasciitis, and there are many different kind of injuries. But these are the very common injuries. Like runner's knee is a very common injury. Uh, Usually happens because of overtraining, and second thing that your quadriceps are very weak. IT band is also is also another knee injury that caused by not only just running but also cycling sometimes, because you are like bending your knee and keep on doing that, and if your hip muscles are not strong, you can end up with that. And when you come down to the foot, it is plantar fasciitis. Many runners do have it. Not even runners, many people have it actually in general
Yeah.
population. Even housewives have them,
Yeah.
and then they come with this pain in the heel that they have in the morning, or one which only lasts for a few minutes when they wake up and it goes away. So that is like a band in your foot that is inflamed,
Dr.
either
Chaitanya,
because of
sorry to interrupt, but as we
no, no,
progresses,
no.
I would like to I would like to listen from you in detail about this. So
Okay.
yeah, the
Sorry,
next
I have like
questions are about this only.
overshot the discussion.
Yeah, we
Yeah.
would like to uh,
So, but
Yeah,
it is
I would
mainly
just like
have
like
to
your
add,
it
expertise.
is.
I would just
Yeah,
like
yeah,
to add
please.
a bit to what Dr. Chaitanya said about the wrong form. What he said is absolutely correct. But also, what we should bear in mind is that each person will have a different form. So
Yes.
there are some people, some coaches also, who idolize one particular form, and then they get behind the trainees to follow that form. That itself can cause injuries. Your body
Yes.
structure, the strength of your body parts will define the type of run that you will have. So do not blindly idolize either. So just following an ideal form of running can also be a cause of a musculoskeletal injury. So that should be borne in mind.
And
Yes.
you have mentioned footwear also. So can you elaborate little bit about footwear? So what
Footwear
is the
is
importance of
absolutely.
footwear for injury-free
Footwear,
run?
footwear is like absolutely essential. It is the most important thing when you talk about running. So if you have see, discussion on footwear can be a long discussion in itself. But yeah, the basics are that if every shoe has a particular mileage. Well, of course, no, we are Indians. We like to take the juice out of the sugar cane till the very last drop. But when your shoe is worn out, it is better to discard it or use it for recreational purposes, not for training. Have a shoe which is commensurate to the type of run that you're doing. If you use a trail shoe for a road run, it is a recipe for disaster. If you have if you are running in shoe which is meant for road running, or if you're running with a carbon plate on a trail, that again is a recipe for disaster. Also, a carbon plate is probably, if you're not strong enough, a carbon plate is also again, the way I look at it, will probably induce an injury. So be very careful about the shoe that you wear, the sizing of the shoe, and the type of the shoe when you select a shoe for your run.
What about
And have a couple of shoes, at least 3 to 4 shoes. If you're running 7 days a week, or if you're running 6 days a week, have at least 3 shoes, if which you can rotate. Give the shoe a rest.
okay? So Dr. Chaitanya, can you throw some light on this topic,
Uh,
footwear?
yeah, I totally agree with Amit, saying that you have to rotate your shoe actually. That will be much more, so that even your shoe needs some rest, because the foam that is under your shoe is also fatigue. So if you can give it a rest of 1 day, it will recover as well. The shoe also needs a recovery a bit. And at the same time, appropriate shoe for appropriate terrain. That I think makes a good thing, and uh, it should be fitting well. There are many shoes available, and it is up to your budget, and then what is your choice, and the race that you're gonna run. So that has to be borne in mind when you are training. So and then I believe there is no ideal shoe actually. To be very frank, like this is the best shoe. No, it's each shoe fits each person in their own way, because we are not machines and we are not standardized models. We have different kind of foot for everyone, and some people have a flat foot, so they need a different kind of shoe. Some people invert their foot. Then there are some other shoes for them. There are eversion kind of foot planters. So when they plant, they evert, which means they do it on the inner side of the toe. So they need a different shoe. There are neutral shoes and all kinds of shoes. There are like huge variety of shoes actually. But I believe like appropriate shoe with that fits you and serves your purpose is one thing when you're buying a shoe. And second thing is, if you have a couple of shoes, do rotate them. And then third thing is that people take out, as Amit mentioned, people take out the juice of the shoe, and we all do it. And the thing is that if they feel that if it is not worn out, like the sole has not really come off, it is still good to run. That is not the case. Now you can keep a track of miles that you have run on a shoe, and then once it is like 800 kilometers to 1,000, you can just retire it and use it for recreation purpose, as Amit has mentioned. That's it. Yeah.
Okay, great. Dr. Chaitanya, so do you warm up and cool down regularly? And how
Yeah, I
important
do.
it is?
Regularly we do that. Yeah, we have to do it. Warm up and stretching is an integral part of training. That has to be incorporated into training, regardless of how small or big your training is. You have to train uh, with these two components are very essential to prevent injuries, and also decrease the soreness of the muscles that you have after post workout. So I do regularly. I do it. Yes,
Regular
religiously I
warm-up
do it.
and
Religiously I do it. Yes.
okay. So even if you are doing a small run or you are going for long run, so warm up and cool down is the must.
Yeah, yeah, it is like, yeah, swimming we do it in a different way, running we do it in a different way, and cycling we do it in a different way. But regardless, it is the same thing, that a warm up is to get your heart rate to a point that it can sustain whatever run you're going to do on the workout on doing you are supposed to do it on that day. And then cool down is like, again, you have to do it stepwise to bring down the heart rate down to a place where you can uh, uh, comfortably go home and relax and all that. So these are, I believe, most of the people who have picked up sports lately, they don't have this routine and they forego cool down and warm up and all that stuff and stretching, and then suffer with the soreness and other kinds of issues.
So, what are your views, Commander Amit, on this warm up and cool down sessions?
I completely agree with Dr. Krishna, but I must confess that I'm guilty of not following this all the time. There are times when I just go out, switch on the watch, wait for the GPS to be acquired, and then just start my run and come back. Cooling down, generally, I stick to cooling down. And whenever I do not do a warm up, it always comes back to haunt me. Cooling warm up is very, very, very essential. It cannot be overemphasized when you're going for a run. It can be an easy 5K or if it is a long 100K. Either way, you need to warm up. It's not only getting your heart rate up. It is about getting that suppleness in your muscles, getting your joints to loosen up so that they're ready for the rigor of the run that is coming. It is absolutely essential for an injury-free running routine. So I would request all runners, anybody who is listening to this, even if you do not do anything else, warm up and cooling down are two essential things that you must stick to.
Okay, thank you for telling our viewers, because I've noticed that especially the beginners, so they generally end up skipping this warm up and cool down routines.
No, not only beginners, the elites. I trained with Suman for a good 2-3 years, and his plantar fascia injury that occurred, it happened because we were meeting up and then we were going for runs, and it was a mistake. We need to learn. Everybody needs to be on it. We need to be at it.
So good that you mentioned. So all of us will learn from your mistakes. Okay, so Dr. Chaitanya, now let's very, very important part which our previous guests have already mentioned, and the importance of this part, strength training. So what role strength training play in preventing running injuries?
So strength training itself, it is in the name itself, it makes you stronger. So making one stronger makes you endure the insult of the training that you're going to undergo, and it also makes you much more fitter. It is actually you are approaching the training in a different way. So as you said, like cross training, you can include weight training in cross training as well. That is also part of cross training, and it depends on the various activities that you do. Especially if you're a runner, you have the different kind of training and strength training that needs to be incorporated into your training. So I suggest that people should do at least lift weights twice a week, and apart from the running that they are all doing. So if you have to go to gym on that day, try to make your running a bit much less intensive in the mornings or on the evenings that you're going. So just don't do a hard day and then weight training at the same time. It really puts a lot of stress on you. But strength training it should be a part of training, and also it can say that it is a kind of a cross training for runners especially. And then it prevents many injuries, as the literature has shown that strength training has decreased the number of injuries, and it has made people much more faster and stronger. So it really helps your performance as well in the long run. So yeah, I totally for it.
Okay.
Yeah, I advise all the runners to just do at least twice a week.
Okay, at least twice a week.
At least twice a week.
Yeah.
Yes. Yeah.
Okay. So, one of our viewer, Dr. Madhuri, is asking that would you recommend lifting heavy or light weights? And does body weight strength training help? So, Commander Amit, can you help us with this? Would you
Yeah.
recommend light weights?
I can recommend what works for me. What works for me is light weights, multiple reps. But when you do weights, I prefer more of body weights and maybe assisted weights. Maybe you can use a angle weight or a very light dumbbell. And when you're doing strength training, it is more focused. It should be more focused on your, or if not more focused, a part of it should be focused on your running routine. So, weighted training for running, maybe using a TerraBand or something for like clamps, hamstring curls, things like this will actually help you to run faster and run better, and it will get your muscle balance adjusted. So whatever imbalance is induced by repeated running, that gets settled, and it helps you stay injury free and become strong.
Okay. So, since having classified injuries, so let us discuss some common injuries now. So, Dr. Chaitanya, now we'll come to the injuries in detail. So,
Yeah, as we have,
okay. Yeah, Dr. Chaitanya, so how do you differentiate between runner's knee and ITB syndrome? And will the treatment be same?
yeah. So runner's knee is usually it's like a dull, achy pain that you have around your knee. Because if you ask actually runner, if you have a runner's knee, he will just say like he will point that like it is around my knee, like it is finger or whatever. And then it is something that he has a dull, achy pain behind his kneecap. And usually if he is going he sits for a long while, like if you go to a movie and sit there, and then when you wake up from the seat, when you get up from your seat, you usually have that pain. So that is a runner's knee. Actually, it is also known as a movie goer's knee as well. Like once you rest, and then it gets worse because the patella is much more touching to your knee and all that. So runner's knee is like it's a whole knee part of it. Actually, so like you can't just point it to somewhere. But if you go to the IT band, IT syndrome, IT pain, iliotibial pain, it is on the lateral side. Like it's on the outer side of your knee. So he can point it out and say, okay, it is hurting me here. But with runner's knee, you can't say that. You will just, you go around and say, okay, it is around here. I can't really point it out. So actually, it's dull. IT band is much more sharper. You can locate it and say, okay, it is hurting me here. That's where your IT band goes and attaches to the knee. So these are the two things, two common injuries that you can have in a runner's, in a runner, the
Okay.
injuries that a runner can have.
So, Dr. Chaitanya, so you just mentioned that when you go to a movie and when you get up, so this pain
Yeah,
I have also
everyone has it. Yeah,
experienced,
most of us have. Yeah.
but while running, by God's grace, I've never experienced any knee pain as such. So
Yes.
is
So
it
less of movies and more of running for you.
no?
Yes, that's a very good question, actually. So what happens is when you run, the synovial fluid increases because you need the lubricant. So body produces that fluid, okay, and then it gets a bit more lubricant is there, and once you move around, it gets warmer, and then all your muscles are also a bit toned up and all that. They take the support and all that, and you feel better actually. So once you stop and sit around for a while, and then you get up, you have that pain. That's why it's called movie goers pain, actually.
Okay, okay.
So that is the reason you feel better once you start moving. Usually the stiffness is there in the morning, but once you warm up, you don't feel like going to this workout. But once you keep moving around, you go to bathroom and come back, and then you go around, put your shoes. By that time, the body will produce some kind of fluid, synovial fluid, that is the fluid in your joints, which lubricates the joints. So you feel better, and then once you start running, it gets better actually. Yeah, it is a miracle that you feel better. But once you come back and then you rest, and once you take your shoes off, and then you feel that pain. So that is a classic. This is
So Dr.
kind of a
Chaitanya,
wear
Dr.
injury.
Chaitanya,
Yeah.
correct my, just listen, hear out my observation. What I have observed is that the runner's knee is generally for the people uh, who have, there's a less strength in their muscles. Whereas
Yes,
the
Scots.
ITB,
Yes.
there's ITB, I have generally found that it is because of imbalance. People have,
Yes, sir.
different strength in glutes. Generally, it is glutes.
Yes, sir.
So if
Yes.
one
Yes.
glute is weak, you will have more, the other glute will work more to compensate for that, and then you'll have ITB syndrome
Yes.
flaring up. Is
Yeah.
that correct?
Very true. Very true.
Okay.
Very true. So ITB is it's like usually on the one side you like these are the ITB is because of the weak hip adductors of the glutes and all these things. Those muscles up higher above on the hip. And runner's knee is like it's like a more around the knee. It is because of quadriceps that are weak. So these are like the two muscle groups. Thanks for bringing that up actually. So yeah, if you're suffering with ITB, then you have to do single leg raises, and you have to do Bulgarian lunges kind of exercises, because running is single leg uh, uh, sport. So ITB, you have is like an imbalance kind of thing. And when it comes to runners, it is because of weak quadriceps, the huge muscles around your thighs, around the joint are weak. So that is contributing one actually. So the way you train for both of them is quite different. Yeah, that's
So
a
this
good
is
point to bring up,
actually a
Samit.
new term. This movie goers is the new term which I have,
Yes, means, yeah.
and till now I used to feel that it is because of the sitting in AC
It is not
for
because of the
3 hours
movie.
continuously, because I'm not a AC person.
It's
So
not
I
because of
thought
the
it is
movie.
because of
Don't
that.
blame the movie.
So thank you for
Yeah,
throwing light on this. So
yeah.
next is these are also very common injuries which most of the runners they experience. It is shin splints and stress fracture. So, Commander and Amit, how do you differentiate between shin splints and stress fracture, and how serious is each?
I think Dr. Krishna would be the right person to, uh, you know, clear it out medically. But the way I look at it is, both these injuries, shin splints and the stress fracture, are generally prevalent among the people who are picking up running, who are new to the sport, and then they ramp up their mileage or they ramp up the intensity very aggressively. So in both the cases, it is the lower part of the limb which is affected. However, in the splints, when you say it's better to let a doctor decide whether it is a shin splint or it is a stress fracture, because both can be very excruciatingly painful. And if you misdiagnose a a stress fracture as a shin splint and keep taking it lightly, it can really, put you in a bad spot. So stress fracture is where because of the repeated stress, your muscles are weak, and because running is a repetitive activity, and because of your that repeated tuck that stress is coming onto the bone. The bone, actually, there are minor fractures in the bone, so that's called stress fracture. If not treated properly, this bone can really, you know, I would not call it break, but this injury can really flare up so much that you will be you will not be able to walk for quite some time. So this should be taken very seriously. Whereas in shin splint, what happens is you will generally feel pain on either side of the bone. It is more to do with the tissue which is surrounding the bone. So shin splints with a little bit of rest ice compression for about 2 to 3 weeks, you should be able to get over shin splints. But a stress fracture needs to be viewed very seriously. And to start with, I would say you need to take a doctor's advice to, if you do not know enough. If you think that you have enough experience, a different issue altogether. But if you are not experienced enough, it's better to go to doctor and let him decide whether it is a shin splint or it is a stress fracture. I think I will leave it to Dr. Chaitanya to elaborate more on it.
Yeah, Dr.
Yeah.
Chaitanya.
Thanks, Amit, for that. Actually, so like few things, like most of it is the stress fracture or the cinch splints is only because of the mechanical strain and stress that you're putting on the bone. First thing is that the bone is a dynamic structure. It is not a static one. Like once you form your bone, it is not for your whole life. It keeps on changing based on the load that you're putting on the bone, and then bone reacts to the load and stress that you're putting on that bone. Okay. And then when you're running, it's as you said, it's a repetitive activity. You keep on banging it on the hard surface of the on whatever surfaces you're running. And what happens is that okay, bone does have micro fractures every day you run, and it also heals itself. Like extra matrix is added, extra calcium is added, it becomes strong. That's how you become strong as well. Like you go through this a minute breakdown every day and keeps on healing and keeps on building it stronger and stronger day by day. So what happens is when people go a bit much more faster or increasing the mileage, what happens is that this recovery, whichever the time to get it stronger is impaired, and the breakdown is more. It is the imbalance between the breakdown and the repair. And when there is imbalance and the repair is lagging behind the breakdown, it breaks down. So it is. And stress fracture, mind you, it doesn't just happen only on your lower limb. It can happen. I mean, it's like on the lower legs, but it can also happen in your hip bone. Actually, many marathon runners, they have broken their hip bones as well. It happens usually. It happens at the neck of the hip joint, and it can happen. Any bone can have a stress fracture if it's stressed. Even the small bones in your foot also get stress fracture. So, but the shin splints is only shin splints. It is on the shins. Okay, it's also kind of a stress fracture, but it has not totally broken up. So, and then the way you do it is usually shin splints are like what Amit said, is that you can get back to your activity once you give some rest and you figure it out how it's working, and rest, ice, and compression will help you actually. And moreover, you can point and then you can say, okay, it is around here, around the front part of my lower leg, it is hurting. The stress fracture is much more, the pain is very much more serious, and if you overlook it, it can actually break. Okay, it has not totally broken up, and if the bone you push it further, a bone can actually break. So that can happen if you overlook it and you have not taken enough care. And second thing is a very overlooked part is one is what we already discussed is overuse, but also the weight of the person who is picking up running was also very important. The weight increases every time you take a step. It is 4 to 5 times your body weight. So if your like limbs are not so strong, if the muscles are not strong enough, what happens is they are bound to break. If you're like a 90-kilo person and you're like overweight when adjusted to your height, that is really a huge load on your skeletal muscles and skeletal structures. So they can break. Even the weight also matters here. That is something overlooked. And usually people who are heavy usually suffer from shin splints. And also you want surfaces you're running on. If you're like running on a concrete surface, if you're running only on asphalt, then you actually run the risk of having both these things. I don't say people who run on grass or grounds don't have it, but the risk of having this increases if the surfaces you're running is very hard. So that also has to be taken care of. Like even terrain matters here. Yeah,
Okay.
that's it.
Okay. So I want to add something to it. So I also
Mhm.
used to have this
Please.
problem of shin splints when I started
Yeah.
running. So the reason was my shoes, my worn-off shoes. So, as Dr. Chaitanya mentioned earlier, so I was not running by the mileage, but I was looking at the face of the shoes and I was running. So, from outside, the shoes was absolutely fine, but actually it was worn off. So, when I changed my shoes, this problem subsided. So, this is, I think, worn off shoes can also be one of the reason. So we can prevent the shin splints by changing and circulating our shoes.
Rotating of shoes. Yeah.
Yeah, by rotating our shoes. Yeah, absolutely. So, Commander Amit, so you have ran so many ultras. So, how do you deal with this toenail hematonia and blisters? So you have ran 222 kilometers and many 100 kilometers also. So how do you manage?
Toenail hematoma, I think, what do you call that? Blackening of, that's what you mean? The blackening of the toes and
Yeah,
eventually the nails, and then eventually the nails fall off.
yeah, nail comes
I
off.
think as runners, all of us would have faced it sometimes or other. And it happens especially when you're doing real long distances. So what happens is over a period of time, when you're running for about say 10, 12 hours, you wearing the same shoe, or you're keeping the shoe in the shoes that you change also in between of the same size, but your feet have swollen. So what happens is the shoe is smaller and the foot is larger, and your toe keeps banging against the top of against the tip of the shoe. So the nail eventually, uh, it it starts there micro tears, and there's some bleeding, and then the nail eventually the root of the nail is has trauma. So only way to prevent it is, which I what I found is to and it worked for me, is that any run which was more than 6 hours, I kept a shoe which was half a size uh, bigger than my shoe size in the drop bag. So after
Okay.
3 to 4 hours, when I changed my shoe, I used a shoe which was half a size bigger for me, and it worked for me. Also, what can
Oh,
work for you is that it worked for me. I said, and what you can do is uh, absolutely essential is that your toenails have to be trimmed. They cannot be jutting out. That is absolutely there. But definitely, what works for me, I need about half a size larger shoe, because when you wear the shoe, I suddenly find a shoe which was not comfortable earlier, was big for me, now becomes comfortable. So that's it. And the other question, you said something?
Blisters.
Blisters, I think that is where your socks come in. The pair of sock that you use, it cannot be just a normal sock for a run, which is for where if you are on the road or on the track for more than an hour, you need to be careful about the sock that you're using. There are anti-chafing socks which are available in the market. I would consider you try them, and of course a little bit of petroleum jelly applied around the toenails and the heel also works. But yeah,
Okay.
what is essential is the anti-chafing sock.
Okay. So, Dr. Chaitanya, like you are also into this endurance running and triathlons. So, what if suppose I am running 100 kilometers and I finish 50 kilometers and again already this my toe nail has gone. So,
Yeah.
any suggestion for that? So, what should I do? I want to finish my next 50 kilometers, and is there any remedy which some tape or something which can help? And I don't have
yeah,
plus size shoes.
I think that even taping your uh, nails around also helps that reduce that friction. Okay.
Okay.
And I felt like I totally agree with what Amit has said earlier. I feel like more once you're running like downhill, most of the time you have these issues with your
Yeah.
hematoma of your toenails bleeding, because like the front part of your foot is hitting it, on the front part of your shoe, and then that causing trauma and all that. But it is unfortunate. If you have it, you have it, and then unfortunately, it is an inevitable part of running long distances, and many people have to endure that. Uh, but some things works for you. Like you have to figure it out while you're training, because that can happen even while training. Like you won't be running 100 kilometers just on one day, and then you'll be running just 5, 10 kilometers other day. You will be running also 20 and 30. And then if you have issues, you have to figure it out, like regarding the shoe. And the second thing is that one thing is that what Mamit has said, like carry a bigger shoe. I never thought about it. Thank you for that wisdom, Amit. And second thing is that you have to figure out the shoe that you are running on that day. Don't use a new shoe on that day. Many people have that fantasy of using a new shoe on the running, on the race day. So don't do that. Try using the shoe and see uh, how it feels on your feet actually. So even that gives you some kind of insight, like what it can do after 40 or 50 kilometers into the race. So I think once you have it, you have it. You have to live with it. Either you
Okay, so
continue
maybe
race,
that tape
or you
will
have to stop it.
will
Maybe
be the
you put a
only.
band-aid around. Means
Bandage.
prevention is the best too. Maybe you might put a band-aid, but I don't know how far will that help.
Okay.
But like try to take measures that can prevent it actually. So try
I
that
think
shoe that you're gonna run.
Another input here. Another input here. There is a
Huh.
runner's loop in the shoes. There's one
Yes.
last hole which none of us use. You're supposed to create a loop and then pass the
Yes.
lace through it. If you do that, it will help you in both
Huh.
the runner this toe hematoma and the blisters. It will help in both the cases.
okay. So one of our
Yeah.
viewer has asked that mid-race blisters how to tackle if you have really long distance to cover. So
That's
anything you want to add on?
Amit can answer that question. He has done so many long distance.
You the only thing you can do is to live with it. You have to finish your race with the
Yes.
blisters. But what
Yes.
works for you is which is contrary to all the medical advice. But what
Yes.
works is
Yes.
that
Yes.
you puncture the blister and put a
Before.
good band-aid on it. Preferably not a band-aid, a doctor's tape on it. So that will prevent further friction and help you complete the race. But after that, you are in for a long haul. You need to see a doctor after that.
And I think your practice sessions, if you practice, if you are going for a humid weather, if you are going to run your races in the humid weather, so I think your practice sessions also should be covered in the same kind of weather. I think that will help you to some
Yeah, that helps
extent.
you. That helps you identify the right gear for
Yeah,
your race.
the weather, yeah.
Yeah, that goes without saying.
Yeah.
That helps you identify the
The
right.
type of clothing which you have to
Yeah,
wear.
it goes without saying that if you're going for a race in hot, humid conditions, a couple of your practice runs have to be in same, identical or close to identical conditions
Setting.
for you to identify the right gear.
I think this will definitely help to solve this problem to some extent. Okay, so now again, very common problems. So, Dr. Chaitanya, can you tell us the reasons for this plantar fasciitis and Achilles heel? You were mentioning this earlier also, and how do you handle them?
So the plantar fasciitis is just that heel pain. Many of us have it actually. You need not
Yeah.
even be a runner to actually have it. Even someone who is working, a housewife can have it actually. So it's nothing. It's like a band in your foot, and as you know, the foot is made up of multiple joints. There are many bones, like 20 something odd bones are there, and then there are many huge number of muscles around which support this foot. And then the foot is not it's a static thing. It expands and it contracts and it has a lot of flexibility in it. And then the band is like, you can imagine it is like a bow, a string of a bow. So the foot is like this, and then there is a string that is around, which is connected on the both the ends. And then it has this stretching every time you take a step. And as you know, if you're running for long distance, this stretch gets a bit more than what it usually should, and it is strained a bit, and then you have this weird pain in your foot. So plantar fasciitis is just an overuse injury, or you are overweight at the same time. And some people have deformities like flat foot. By genetically, they are flat foot. They also have the increased chance of having, they're predisposed to have plantar fasciitis. So one thing is keep a track of the mileage. Second thing, on the surfaces that you're running actually, like keep a track on what you're running. Like, yeah, what I suggest is that different shoes, different terrain, different speeds. Okay. So if you have only one shoe, that's a different thing. But if you have only one shoe, then either these two things have to vary. The terrain has to vary, and the speed has to vary, and then shoe has to vary. So in that way, you're challenging different kinds of muscles across your foot. So plantar fasciitis also can happen if your foot muscles are weak. So if you're running on flat surfaces, like just running on a ground, or you're running on tracks, so usually your foot muscles are not challenged, and then once you don't use it, you lose it. But if you're running like a trail runner, or you're like running on undulating surfaces, in such cases, what happens is your foot muscles are forced to work because you have to catch the grip of the terrain. If you're running like on a trail or something, and then you keep using those muscles, and they get strong, and then the whole weight is not transferred to the plantar fascia. It's a thick band in your foot. So the other muscles are also trained in such way passively. So then the chance of you getting this plantar fascia is less. But you get it, then you have to really take off from training. It is a very painful condition. I don't suggest anyone to run with plantar fasciitis if they have it. Try to change the footwear. Maybe the footwear is also a culpable thing in this injury. So make some changes and try to see what fits you actually. If you're running on the asphalt, change to something like a sand. Even sand running can also help us. It takes the impact. The impact is less. So if you're running on sand, something which is overlooked, but many people don't have access, especially if you have a beach, then it's a different thing. You can run on sand, and then that gives you a lot of workout for all your foot muscles. If they're strong enough, I think you can take off that extra strain that the plantar fascia is taking. So I suggest that they keep on changing the terrain, and if they have it, they have to take off. And then
Okay.
there is a physiotherapy, there are stretches for that, and then pain medications. And if it doesn't get better, you see a doctor. But regardless, it is always in orthopedics, it is always rest, ice, compression, and elevation.
Yeah.
So they just ask one question: what is causing this pain? And then if that is causing, you don't do it. That's it. That itself is a medicine for that. And second thing you're mentioning about something else. I'm sorry, I didn't get that
Yeah,
part.
it is Achilles heel.
Oh, Achilles heel is another injury. It is behind your heel. That huge muscle, the calf muscle, comes and attaches to your heel bone. So it actually it is also another painful condition. So it can also happen because all these injuries are because of overuse and increased
Overuse.
intensity. That is a blanket thing. You cannot have injury just sitting at home. So if you're running an active workout, you can have this injury. Even the thing is that it usually happens in people who are jumping. Usually jumpers have those things, but also runners can have it. And also stretching and making and then regular weight training can help this in preventing these injuries. What I say is prevention is the best cure. So don't push yourself to that point that you get injured. Rather have that balance of not pushing forward in spite of pain and all that. And the worst part is both these tissues can tear actually. And if they tear, then you are off for 6 months. So you can have a plantar fascia in tear, and then also the Achilles tendon tear, which can happen. And both of them are very serious kind of thing. You have to go to for surgery, and then it costs you money, and then you might even stop the sport that you like. So both these things can happen. Yeah,
Okay, so timely intervention is important.
time injection. And then training plan is important actually. Training should be balanced. So mostly people will go all the weeks they go on a relay like a mad rush. So usually most of the collective wisdom says that you go 3 weeks hard and then 1 week easy, so that it
Yeah,
gives some time to your body to recuperate,
recover.
recover, heal itself, and all that.
Oh,
So give time to recovery as well. Yeah.
okay. So once an injury has surfaced, so where do
Hmm.
you draw the line? Commander Amit, when do you go to a medical practitioner and to whom?
So that's a very good question, actually. And most of us, I would say, are guilty of not timely seeking help. Most of us. Uh, we, go by Google, we look at YouTube and try to self medicate, and it backfires many times. So if you have, you need to identify if it is soreness. It is okay. It will go off with time. Injury which is cropping up, you give it a rest. The standard RISE protocol you follow and wait for a couple of days and see if it is getting better. If it is not getting better, and any injury, specifically injuries like shin splints or stress fracture or plantar fascia or Achilles heel, these are the things for which it is absolutely essential that even if just give it about a week, nothing more than a week. If for a week the pain is persisting, I suggest you go and see a doctor. Uh, the doctor, it's better to you can go see if we have a problem when it comes to looking for a sport specialist in the country. So I would, be more comfortable for going to a doctor who is himself into sports. He can be a normal physician. I do not want a doctor to be having too many degrees and not being able to identify or not being able to understand what I have gone through. So a normal physician who is himself into sports, who understand what goes into the routine and what goes into the mind of an athlete, I would prefer going to him, and it works. It works most of the time.
So who can relate to your problem?
Relate to what's happening with me. I can go to an orthopedic surgeon. It has happened with me. I've gone to orthopedics and I've told him ki, yeah, this has happened because of running, and he tells me, no, no, sir, aap bhagna band kar do. Why are you running so much? So I would not like to go to a doctor like him. I would be okay to go to. I would prefer to a physician who can understand, because he understands basic physiology of the human body. He understands basic anatomy of human body, and if he's himself an athlete, he will be able to identify and give me a solution, or at least point me in the right direction.
Okay. So, Dr. Krishna, so being a medical practitioner yourself, can you suggest different specialists for various injuries, or we should
So,
go by what Commander Amit just said?
so this happened with me as well. Like they asked me why you run in the first place, and they don't understand the psychology of being a sports person. Like this happens to me as well. Like even if I go to orthopedist, doctor, why are you running? Why are you doing all this stuff? So it's hard to explain to a doctor like why am I running. So someone who is not in sports, he cannot really relate to us, and someone who cannot relate to us, we don't feel that we are treated. So that happens. And unfortunately, the second thing is most of the population is not into sports. It's not like Australia or other countries, OECD countries, where the huge number of population is into sports. So unfortunately, we don't have sports specialists. Uh, at least in Visakhapatnam, I have never come across one. And whoever in sports are maybe playing cricket on a weekends at the most. That's what that's at the most they can do. Most of the doctors I have come across. But uh, uh, the thing is that when you have to see a doctor and when you can cure it by yourself, it is also a big thing. And I think that Google, I'm totally okay with Google. Even I Google for my medical answers. Now the AI has come, so I go to ChatGPT or Grok or whatever other tools are there. There's nothing, no shame in it. I don't discourage people knowing their condition, because you should be knowledgeable to find out yourself. That is the point of being a experienced runner, that he can figure it out himself, like what is exactly happening. And then there is no shame in it. Like if you don't know, then you have to go to a doctor. But always a medical professional with a degree is more knowledgeable than what you can figure it out. So I am not against AI or using Google for the answers. Even we do it for ourselves. So what's the point? And even people who are educated and who have the medical degree goes for Google, and you can also go on Google and see, find out. In one thing, if it will at least let you know that what your condition is. At least you can diagnose it if you're knowledgeable enough. You can self-diagnose yourself, but don't treat yourself. That's what I say. You can diagnose yourself and go to a doctor and say, okay, this happened with me. This is what I did. I feel this thing is happening with me. So that can be taken care of. And then everyone has their own approach in treatment and all that. But the blanket treatment is rice. There is no other way. Like if something is causing you pain, they ask us to just stop doing that. And second thing, people have problems stop doing sport is that they feel they might get unfit. Okay, they feel like, okay, if I just stop running this week, my Strava will look bad, or people will not be giving me kudos and all that, and people will ask why you're not running and all that. There is no shame in it actually. There is no shame in stopping because there is a lot of pain behind it. Actually, when you keep doing it in pain and all that, and it is much more dangerous to do when you're in actually in pain and all that. So what I suggest is, means it is always going back to the same thing over and over again in injuries, that be knowledgeable. Even if you don't have it, any of your teammates have it, try to read about it, try to gain some knowledge about how he has gone through, because you're always learning from others' experience rather than your own. That actually makes you a better runner. Um, so this is what I suggest to all the
So
runners.
don't treat yourself. That you can
But
diagnose
diagnose, try to
well, and
know
don't treat
actually, like
yourself.
try to find out what is happening, because this is all about
And
learning.
timely
Learning is all
intervention.
about
Timely
yes, yes,
intervention.
exactly, yeah, yeah,
Okay.
yeah. Means if
Okay.
you are in pain, don't do it. And exactly at the same point, if you have pain doing running, you can. There comes the cross training actually. Like if you are feeling that you might get a less fitter, or like you might lose the fitness, and that you have all built up for the race and all that, and race is approaching fast. If you are in that fear, you can do something else. Like if you are like gifted, like you are a swimmer, you can do swimming,
Swimming.
because it still challenges your body in the same way, uh, more or less. Or if you are like having shin splints, you can do cycling, because cycling is a no impact sport. So you can do cycling in that thing. But if you have a runner's knee, even cycling can and can exacerbate those symptoms. So you or you can go to a gym if that is the case. You feel that you might fall back behind your competitors. Then you can go to gym and do that and challenge your body in a different way, instead of pushing through the pain. That I suggest that cross training, and also can help patients who are in this having injury because of worries and all that.
Okay. So, see, recovery from injury is complicated. Physio,
Ah,
medication, off training. So you start
surgery.
getting restless. So,
Ah,
Commander Amit, how long one should go off training?
Uh, just now, Dr. Chaitanya was explaining, and I couldn't agree more with him. Uh, it's a fine balance. It will depend on the injury that you have, the extent of injury that you have, that how long you have to go off training. So, if it is a major injury, I would let the doctor decide, and I will not, I will not question a qualified medical practitioner's wisdom on this. So I will let a doctor decide how long I should be off training. And more than that, when you're off training and you're getting into the training, so that's very important. So recurrence is something that happens very, very often in this phase. So that is what is important. You need to ease back into, let the doctor take care of your injury, and let him tell you that, okay, now is the time to go to physio. Go to physio, let the physio bring up the strength, let the physio tell you that, okay, you can resume your training. And when you resume training, I would suggest you go in a very, very easy manner for at least good 15 to 20 days. And then see how it is affecting you. And then very, very carefully, very, very gently ramp up the training. So to ensure that it doesn't recur.
Okay. Yeah, this is very common. We have observed that recurrence is very common. So, Dr. Chaitanya, do you want to add something to this recurrence? How can we
Yeah,
prevent it?
I think once you come back to training after the injury, stay grounded for a while. That's what I feel like. What Amit has said, like stay grounded at least for a while. See how you're doing. It's like people who are running like 100 kilometers a week prior to injury, and they get injured, and then they go for rehab and all that, and come back. They can't go straight away doing 100 kilometers mileage again. Although they can push themselves and they think in their mind that, okay, I was that fit, I can still do it. So rather, I would suggest that you, because you have taken some time to reach that kind of mileage, now also you should pursue the same path, like a ladder pattern, that you go from starting from 20 km a week to 30, and then gradually increasing it.
Gradually.
Because you should always remember that how you got into this place. How you got into this place of getting yourself into, and don't repeat the same. If you're repeating the same, and then again you will be in the same position, as you'll find yourself in a worse position than what you have been earlier. So don't repeat the same mistakes. Learn from your mistakes and stay grounded, and come back strong, and then try to make changes in your training, so that it will not happen again to you. So that is how.
Listen to your body, and don't go by this social media influence. Stay away from.
Even if your buddies are like pushing harder, you always fall in the trap that I have to push faster as well. So just stay grounded, and then take it easy. There is no rush, and then try new things and try to prevent that injury happening again to you. Yeah, that's very important.
Okay. So there's one of our viewer is asking that how much valued is foam rolling for keeping injury free?
I think.
I have seen Commander Amit using foam roller very regularly, so he can throw some light on this.
Yeah, he can do it.
I would say
why I'm not doing it.
Yeah, absolutely essential. If you are a runner who runs, say, 5 days a week, you need to foam roll 6 days a week. That is how important foam rolling is. And it doesn't take much, just about 10 minutes of foam rolling. A quick, you can work out a schedule for your foam rolling, you can work out a pattern. And quickly, when you foam roll your body, what they say is, Hindi mein dekhi gaanthein pad jati hain body mein. So wherever there are, the spots where the lactic acid accumulates, you can quickly foam roll that away, and you will be better recovered, and you will have a better, more stronger run the next day. Absolutely essential. The only thing that I would recommend is foam rolling should not be done immediately after your workout. If you run in the morning, you do foam rolling in the evening. I personally do that, and it works for me.
Okay. So see, running, it looks so simple, but there's a lot of science behind this simple thing. So any other question? So, okay. So thank you, Commander Amit and Dr. Chaitanya, for joining us for episode 3. And you have really given us so many tips. I think our viewers will definitely be benefited by the suggestions you have given, the experiences you have shared. All of us will be benefited by your experiences. So thank you so much again for joining us. So now you can leave.
Thank you. Thanks for having me.
Thank you so much.
Thank you.